Thanks everyone for joining today's webinar. Today we're going to be talking about how to effectively plan for a CQC inspection. So hopefully that is relevant to everybody here today. So just a bit of background information about us. My name is Finnigan and I'm the Sales Director at Rotamaster. I've been with Rotamaster for 8 years now, and Rotamaster itself has been around for 23 years. So we provide workforce management software to a wide range of health and care providers across various sectors, including community care, residential care, primary care, and some NHS trust departments as well. We currently have over 60,000 NHS and healthcare and care staff using the software on a daily basis. And we are the only workforce management software that has been exclusively designed for health and care organisations. So just a bit of an introduction using some figures that we found from September 2022. CQC inspections will be conducted once at least every 5 years. So if you haven't had one within the last sort of 4.5 years, then expect to be hearing from them soon. They will be more frequent if adequate or requires improvement rated inspections had been previously received. You'd normally be looking at getting at least 2 weeks notice, a letter informing you that a CQC inspection will be taking place. However, there can be ad hoc and unannounced inspections as well, based on if there's been a complaint or a concern that somebody needs to look into. That can mean that an unannounced inspection takes place. And ratings received from CQC inspections allow members of the public and individuals to compare services and make a choice about where they receive their care. So because of the short window of time prior to an inspection, it is important to sort of have all your ducks in a row and be prepared long in advance of that taking place. So there are a number of different ways workforce management software can help prepare you. So of those of you with us today, I'm not sure how many of you have workforce management softwares in place, and some of you may not at all and may never heard of them. But there are several key ways in which we can help you to prepare for a CQC inspection. So the first one is managing training and compliance. The second one is managing safe staffing levels. And the third is reporting. So we'll be covering all of those in more detail today. So training and compliance. So the CQC's role is to ensure that your staff are qualified, competent and experienced, and they want to make sure that they are capable of providing the level of care that is expected for your service. And failure to comply and provide evidence that you comply will result in CQC registration being refused. So it isn't just important to comply, it's important to be able to evidence that you comply. And you can do that very easily when you have a software like Rotamaster in place. So rather than having all training compliance details on people's individual paper personnel files or on a spreadsheet that needs to all be compiled into one place, Rotamaster will allow you to store all compliance and training information. So you can store certificates, you can store any training documentation that you want to against a person's individual record. You can receive automated reminders for when training or compliance data is due to expire, things like DBS checks or whatever other types of compliance data you hold against your staff members. The individual will receive a reminder and their line manager will receive a reminder. And you can also pull off automated reports around when training and compliance is due. So if you get a CQC inspector saying, right, how many staff members do you have that are trained on X and when does that training expire, you can simply pull that information off. So it makes it very easy. It guarantees that each shift is staffed by a qualified and competent and experienced staff member. So you can put skills against each staff member's record, and you can also put skill requirements against a shift. And when the staff member is coming to book into that shift, the system will ensure that they have the relevant and required skills and compliance data in order to work that shift safely. So if they try to book into it, it will flag up and say, oh, your X has expired, or you don't have the required skill for this shift. If an administrator tries to book them in manually, it will again flag up and say that the person does not have the required compliance data for the shift. And all of this is fully auditable, so you can see what has gone on and work backwards if ever needed. Safe staffing levels. So this is about ensuring that your service has the right number of staff on at the right time to provide the level of care that is required for your service to be managed safely and effectively. And again, it's about having enough suitably qualified staff members in order to facilitate that. And again, Rotamaster can support this, as with other workforce management software. So we provide an auto scheduling function. So essentially you can, in Rotamaster, provide a template as to how many of each type of role you require and what the start and finish times are for each shift, in which location and what skills they require. And then you can put in your staff members, their working hours, their skills and compliance data. And instead of somebody sitting with a spreadsheet and manually entering when each person is due to work, you can run the algorithm, which is called the allocation wizard, and it will prioritize business critical shifts first. So you can prioritize different shifts, but it will automatically fill the rota with qualified staff based on their skills and their availability and also the requirements of your service. So again, instead of somebody sitting with a spreadsheet and trying to remember who can do what and spending a lot of time doing that, it can just be done with a click of a button in just a matter of seconds. And that does save our services a great deal of time. The auto allocation function will also help maximize shift fill rates. So again, when someone's manually organising a rota, not only does it take a lot of time, but it's hard to make sure that you get the maximum shift fill for the staff members you have. So sometimes for example, if you work over multiple locations and you're not using the opportunity to pull staff across those multiple locations because it's too difficult to manage that manually, you can now do that on Rotamaster, so it makes it much easier to do it automatically. The software will also manage attendance data in real time. So if there's a scenario where you need to ensure that you have X number of staff members on, you can literally see on the screen as people are arriving, and you can count, there's a tally to say how many people of each type you have in place, how many have arrived at the service. So even if people are late, you are able to manage that scenario as well. It will automatically feed payroll with the relative shift fill information as well. So it will automatically calculate how much each person is due to be paid based on the shifts that they've worked, based on the time and attendance data that's been collected, and feed that into the payroll system instead of you having to calculate that manually. And finally, reporting. So what the CQC expects is good governance processes and systems in place to manage and check on the quality of safety and care. So again, it isn't just about being compliant, it's about being able to evidence that you are indeed compliant. And when you get that letter to say that a CQC inspection is due to take place, not having to run around like a headless chicken trying to make sure that you've got all of that data in a readable format for them, just being able to use a system and have that robust reporting can help you prepare early. So you can just be assured that you have all of the reports that you need and you can just pull them off as and when required. So you can, we've got over 250 customizable reports within Rotamaster, and you can also build your own reports with our data API. So anything that you need to know about your service in terms of how many staff members you have on at X date versus how many people of a certain type of skill you have, this is when all the DBS checks are due to be renewed. All of that can be managed with the click of a button and gives you a complete oversight of operations that you can share with the CQC to demonstrate and evidence your compliance. So what to do today, just as a closing thing, 3 takeaways that you can implement right now. So review your current systems. What are your current processes to manage and track everything that CQC might ask you about? And how are you going to address any potential issues before they may arise? So is it a case that you have lots of different things on different spreadsheets, saved on lots of people's desktops, and it's going to be a case of hoping that all of the right people are in order to prepare for that inspection? Or do you have a robust system in place that will enable you to have all of the data you need at your fingertips, and for higher management to have access to that, as well as managers on the ground as well? Have you looked into workforce management software? So I would definitely encourage you, if you've never looked at it before, to really review workforce management software and how it can benefit your organisation from helping with CQC inspections. But not only that, help you manage your day-to-day rotas, your staffing levels across your service, enable staff members to request shifts, book into shifts, book overtime, request annual leave. All of the things that staff members need to be able to do can be done on Rota Master, and it really does help you manage your service effectively. And, you know, instead of everything being done on paper or in spreadsheets, it just gives you that central location for everything to be managed effectively. And compare costs. So review the cost of operating without workforce management software. So time spent manually performing tasks such as filling the rota, time spent calling staff members and asking them when they can work, time spent emailing out lists of shifts. How long does all of that stuff take? How long does it take to manually calculate pay and manually enter all of that into a payroll system? And, you know, look at paper timesheets and things like that. And how long does it take to manually compile reports for big events like CQC inspections? And, you know, once you've considered all of those factors, you'll probably find that workforce management software is absolutely worth investing in and worth looking into further. So that is the end of today's session, and I hope it was somewhat useful. If you do have any questions, please get in touch. My email address is there. And we'll be happy to follow up with anybody that wants to hear more about it. But for anyone that has got a CQC inspection coming up, best of luck, and I hope that you get the desired result. Thanks, everybody.